Access to healthcare without barriers is a fundamental right for the deaf as outlined in the UN Convention on the Rights of People with Disabilities. Well, deaf persons have faced unique challenges in their daily lives, particularly in Africa. They struggle to communicate in the same way as others, which can be isolating. Well, and for those who also have mental illness, the burden becomes even greater. But as GHOne Nadima Umar Uthman reports, mental health is as crucial for the deaf as it is for everyone else.
Just 3 years after giving birth to her daughter, Cynthia Okine discovered that Christine was deaf. Cynthia noticed her daughter's isolation and unusual behavior, prompting a visit to the hospital. At the hospital, they learned of a physical issue that could affect Christine's speech and the beginning of hearing problems.
Assessment Center.
They referred us to several hospitals, but it didn't yield the results we were hoping for. After spending so much money, it was a devastating time for us.
4 years ago, Christine faced another challenge, a mental health disorder. Despite being deaf, she complained of hearing strange voices, a confusing situation for both her and her mother. Communication barriers at the hospital led to a misdiagnosis, causing her condition to worsen.
I tried communicating with my parents, but they still couldn't understand me. I felt like
I was communicating, but no one understood. It was one of my lowest moments living as a deaf person.
According to the World Health Organization, over 5% of the world's population suffers from disabling hearing loss. In Ghana, that is about nearly 500,000 people. Here, the deaf community does not only face communication barriers, but also stigma and prejudice. Struggles to function in a hearing world can lead to mental health issues. For instance, research has revealed that deaf people experience mental health issues at a rate approximately twice that of the general population. Common mental health issues within the deaf community include depression and anxiety, as well as more severe illnesses such as bipolar disorder and schizophrenia. However, a study by the Ghana National Association of the Deaf shows that psychiatric diagnoses of the deaf in Ghana are often inaccurate, and this is made worse when there are no interpreters available.
Right from the time I graduated from medical school, which was over a decade ago to now, there has been no facility I have worked on where I was aware had sign language interpreters available. As our work is based a lot on our interactions, verbal, and getting a good history, so you want to be able to get a quality history because that informs the diagnosis and informs treatment plan among others. So where there's that bridge and where there's that gap, then it begins to impact the quality of care that the person is getting, and not just even with history, from even accessing care before they even get to the consulting room.
Deaf individuals face additional hurdles in accessing vital health information because of limited access to radio and television broadcasts in sign language. Juventus Diorina says, despite the passage of the National Mental Health Act and the establishment of the National Mental Health Authority, barriers to healthcare for the deaf still persist. He is the executive director of the Ghana National Association of the Deaf.
Even if you are going to a hospital, the deaf person will have to bring his or her own interpreter, pay the interpreter.
We say mental health is a universal right, but we are always marginalized. Interpreters should be part of the National Health Insurance Scheme. We don't expect these persons or their caregivers to pay for health care and also pay for the services of their interpreters.
It should be added to the health insurance so that they wouldn't have to pay for them, but the health insurance will cover their medical bills, some of the special drugs that they need.
The availability of interpreters proficient in sign language is very limited in Ghana, with fewer than 100 certified. This puts a lot of pressure on interpreters like Jonathan Dako in Tim.
You see me sometimes running from school, coming home just to interpret for some of them. If government could have interpreters being stationed at hospitals, being stationed maybe in the district to help us, help deaf people access these facilities, then that one, it takes the burden from the deaf people so that the government can absorb them into the system. We have a lot of interpreters out there who don't have work to do.
Ghana currently spends just around 1% of its total government health expenditure on mental health. This growing burden has serious consequences for the country's economy and its marginalized population. Meanwhile, Christine says she hopes that government will allocate adequate resources to empower healthcare professionals, caregivers, and the deaf community. She says this can play a crucial role in diminishing the social stigma associated with mental health issues among the deaf community, promoting early detection, and ultimately fostering more effective support and care. The challenges faced by deaf people dealing with mental health issues in Ghana underscore a compelling and immediate demand for healthcare that is both more inclusive and readily accessible, because experts say these challenges are indicative of a broader systemic issue that goes beyond mere medical care. Reporting for GHOne News, I am Nadima Omar Uthman in Accra.